Yes, sir, you can start.
Yeah. Good evening, everybody. I'm welcoming all to our today's program. Surendra sir will take the session now. Surendra sir, please.
Good evening, good evening.
Good evening, sir.
Two,
Good evening.
2 weeks back, I sent you a chart. Mr. Anup has sent a chart. I've asked you to follow the chart. I'll explain to that because it is the right time. Colds, flus, and coughs. Good afternoon, Professor. Cold, flus, and coughs. So we segregate. So that we can choose a correct medicine. Because there are many number of medicines in homeopathy that chart give you to an extent a clarity. Supposing there is a high fever, you take belladonna. So belladonna is for fever. What is the character of belladonna? Acts where every part of the nervous system, acts vascular system and glands. So in the fever, for morbidity, high fever, only high fever, no cold, no other symptoms, then belladonna we choose. But there is no high fever. Aconite and ferrum phos. Aconite, why? For suddenness, acute violent and sudden affection as well as fever problems. Exposure to dry cold weather and cold air. Due to that, this problem will happen. Supposing from Chennai you go to Kodaikanal or Ooty or Nainital, Shimla, suddenly these things will happen. You can take aconite, you also should take dull camera. Then comes ferrum phos. Why ferrum phos? No fever, but body ache and other things. Every stage of febrile condition stands midway between aconite and bell. All catarrhal inflammation fevers, first stage. Before onset of fever and other things, you feel this bruised feeling in the body. So ferrum phos, mere ferrum phos helps. Ferrum phos, if you can take calimure also, it will be more health. But there is no fever, no flu symptoms. Then what is it medicine? But there are some symptoms in the body. So gelsimine is the medicine. It centers acts on nervous system, causing various degrees of motor paralysis, paralysis of various groups of muscles, eyes, throat, chest, larynx, and sphincter muscles, extremities, or muscular problems, soreness, neck and shoulder problems are there. In other words, you feel feverish due to cold and other symptoms, but they are not predominantly showing cough or other things, but you feel somewhat inconvenient. So gelsemium comes. But there is no restlessness. If there is no restlessness, Rustox, Eupatorium perfoliatum, Arsenicum album will come. Sometimes Naxamica bryonia also helps. Naxamica for morbidity in the body. Disease of cold stages predominates, aching limbs and back, every stage of fever, chillness is on being uncovered and do not allow to cover. Bryonia acts on serous membranes. See, every part of the body or any one of the part of the body gets affected. Here, only serous membranes are affected, aggravates any motion, that is movement, vertigo from raising, pulse hard and tense. You feel that you are likely to get fever. So bryonia helps. Chill with extreme cold, etc., etc. But there is no restlessness. Rustox, Eupatorium perfoliatum and Arsenicum album. Rustox why? That is rheumatic pains, mucous membranes affect, typhoid fevers, frequently indicated heavy head and septicemia. So these are all predominantly symptoms where you feel that though fever is not high, it gives disturbance in the body. So Rustox will help. Then comes Eupatorium perfoliatum. It is aggravated form. That is bone set. It is known as bone set. Relieves pains in the limbs and muscles and breakbone fever. It is called Eupatorium perfoliatum. It was an indicated remedy in COVID symptoms, malaria, influenza, etc. Gastrohepatic region and bronchial muscles and membranes are affected. So, though there is morbidity deeply inside, they show by way of pain in the body. So, Eupatorium perfoliatum, particularly backbone and bones and muscles. The other one is Arsenicum album, acting remedy on every organ, tissue during nightly burning. You feel heat and burning in the nights, not in the daytime. So arsenic album. So now you understand how the fever conditions of different origins are being analyzed by the physician and medicine is chosen. Medicine is chosen. But there is no cold symptoms. Sorry. When there is no cold symptoms, you take Naxamica, Mercurius pulsatilla. Only body disturbances, no cold or sneezing, etc. Naxamica, Mercurius pulsatilla. You know Naxamica, general remedy, antidotes, all the morbidity in the body. Mercurius, pale, earthy, dirty looking, puffy, aching, facial bones affected, generally gastric and bilious affections, nightly perspiration, etc. So these are all the medicines for choosing directly the Mercurius. Then pyrogenum. Yes, I will come to pyrogenum later. Naxamica and bryonia are there. I have given that. Then pulsatilla. Pulsatilla is for hoarseness, cough, dry cough in the evening and night, copious mucus expectoration. Pulsatilla. If it is aggravates, it becomes ripe cold, pulsatilla also given. Then comes Allium cepa, arsenicum, natrium, when there is no cold symptoms. What are the medicines? Allium cepa, arsenicum album, natrium mure. Allium cepa is prepared from red onion. Acrid nasal discharge, eye secretion, worse in the warm room, etc. That is, here the cold symptoms are predominantly shown. Arsenicum, high temperature, intermittent fever, septic fever, hay fever, cold sweats, complete exhaustion, worse after midnight. So you can go directly to the arsenicum. That is why we take arsenicum as a prophylactic in the COVID and other matters. Even today, even for COVID variations and morbidities, arsenicum album is indicated. Then comes natrium muriaticum, chloride of sodium. Chillness between 9 to 11 a.m., heat, violent, thirst, increase with fever. Heat increase with fever. Thirst increase with fever. Then comes, there is no cough, but cough and croupy. Croupy means dry cough. Dry cough, hawking cough. You feel sore throat also while coughing. Spongia tosta is the best medicine. Great dryness of all passages of this throat, lungs, etc., etc., pharynx, etc., etc. But one, there is two diversions. There is a cough from the throat or the lungs. For cough from the lungs, Bryonia phosphorus causticum. Cough from the throat, Rumex chalybite pulsatilla, etc. I'll explain. Bryonia. We all know Bryonia is for dry cough, dryness all over the body. Soreness in the larynx, trachea, chill with external coldness, internal heat, gastrohepatic complications. So here you give medicine. Even the gastrointestinal hepatic complications also are being touched, etc. Then comes phosphorus. Chilly every evening, lack of thirst, unnatural hunger, hoarseness, worse in the evening, larynx very painful. So, Bryonia, phosphorus, causticum, they all come in for larynx, trachea, mouth, and other things, with or without pump. That is, they concentrate on the lungs. What are the problems in the throat medicine? Rumex, Calibite, pulsatilla. Nose dry for Rumex. Tickling throat in the pit causes cough. Copious mucus discharge, rawness of a larynx and trachea. How Calibite helps? Voice hoarseness. Raw, if you speak, your voice is not audible and clear. Hoarseness, worse in the evening, hacking cough, yellow expectoration, very glutinous, causing long, stringy, croupy discharge of mucus, extending to larynx. Then comes pulsatilla. Pulsatilla is aggravation of Calibite. That is, when simple croupy discharge is there, ropey discharge is there, it's white Calibite. When it becomes yellowish, pulsatilla is there. Hoarseness, come and go, dry cough every evening and night, copious mucus expectoration. Then comes aconite and heparisol. When there is no dry cough, there is no croupy or cough, no problem at all, then why sir, why medicine? Aconite is for cold stages, mostly marked on the sweat drenching. See, that is, entire body drenches in sweat. Heparisol, chilly in open air, dry heat at night, and profuse sweat, etc. So that is how we segregate all our medicine. Apart from this, we have got two other medicines. Baptisia, that is, all aggravations due to septic fevers. It lead to septic fever. Baptisia, due to epidemic influenza, chill at 11 a.m., dynamic fever, typhus fever, shipboard fever, that is seasickness, etc. Influenzinum, this is a latest nosode invented by the homeopathic system of medicines, where the medicine is prepared from the inside. Then why you take all other medicine? Why don't you go directly to the influenzinum? No, you cannot insert a morbidity directly into the body. Because previously, they were only manufacturing 200 potency. Nowadays, they are giving you even at 6 potency. But that is only to be used when there is necessity or the symptoms tally. Now, you now know the great picture of cold, flu and coughs. All these things lead to setting of fever, either due to morbidity that has arisen from inside the body, or external cold and climatic changes, or your own activities, exposing yourself cold too much, etc., drenching in the rain and not taking any medicine, etc. Particularly, even 40 to 30 years also people are getting when they drench in rain. Previously, when we drench in rain, we come to the home, nothing happens to us, etc. Now, I give you another simple run through. Is there high fever? Yes, belladonna. No. Aconite, ramphas. No high fever, no fever, go to flu symptoms. Yes. Flu symptoms flu symptoms are predominant, yes, gelsemium. That is so, restlessness. No restlessness, Naxamica bryonia. Restlessness, Rustops, Eupatorium, perfoliatum, arsenicum album. So, no restlessness, no predominantly flu symptoms, etc. Then go to mercurius or pyrogenum. Then go to cold symptoms. Is there mostly cold symptoms? Yes. Yes means Naxamica, mercurius, pulsatilla. No cold symptoms. Alum cepa, arsenicum album, natronol. When no cold symptom, if you give alum cepa, it won't help. Yes. Then comes flu symptom. Cough predominant. It's the cough and cropy, spongia. No cropy or spongy cough. Aconite heparsal. If the cough or cropy, no cough, then go to the throat, lungs and throat. For lungs, bryonia, phosphorus, causticum. For throat, rumex, chalybeate, pulsatilla. All these things are there, not there. Only cough, go to again spongia. This is what the entire picture reveals you. I think you are very clear now to choose your medicine. You keep this chart. It will easily lead to the correct medicine. Simply. Okay. I think you are very much clear in this. If any doubts are there, you can ask.
Sir, this is always confusing. It happened to my treatments. People come and say it's cold symptom, there is sneezing, there is mild cough, throat is having problem, mild fever. So I used to give either gelsemium or belladonna or arsenic alb or heparsal sometimes. But I find not immediately getting the cure. I always get confused. So your chart is somewhat helpful, but this as a generic cold symptoms with the sneezing, throat infection, slight cough, and mild fever, I think gelsemium is the best option.
See, gelsemium is a beginning medicine. That is, there is no fever, high fever, but only body ache, flu symptoms, etc. Gelsemium is correct. But your case, what you have said is, it is aggravated from gelsemium. So, along with gelsemium, you must give Eupatorium perfoliatum or mercury, if the right cold is there, pulsatilla or phosphorus, or if it is leading to flu or influenza, you may think of heparsal or pulsatilla or mercurius. According to not many medicine, one or two. Along with that, give ferrum phos natronol. Choose one head remedy. Gelsemium you have taken correct remedy because it is not aconite stage, beyond aconite stage. So gelsemium, along with that, you take other remedies, flu symptoms or body ache symptoms, fever symptoms. Take one medicine. Along with that, give them strength. We can give bio number 11 fever, or you can give Ferrum phos, calcium. Ferrum phos is for strengthening the nervous system, giving oxygen to the body, circulation, etc. Then Calimo tries to remove the morbidity from inside, expel the morbidity. If the right code is there, go to pulsatilla. Pulsatilla. Any one remedy that follows. Give for 3 days to 5 days. But don't forget to give biosol. You will have immediate relief. Okay.
Okay, sir. Thank you.
Thank you. Sir,
Anup sir,
yeah, if it is over, I'll take up the.
Influence GM is not given here, no, sir. You only
Sir?
mentioned influence GM.
Influencer is not in the list, but we can give that.
You mentioned it.
No, it is, yeah, he mentioned it is not in the list.
Okay.
Yeah,
okay.
yeah,
Okay, sir. I am handing over to Anup.
yeah. Thank you, sir. I'll just discuss this diabetic related cardiovascular disease. Diabetes and cardiovascular disease. This is the symptom which, this is a disease which I think, we all should remember, because elderly ages, elderly people, and we will have diabetes, and how it leads to the major problems of the heart. So all knows our heart is the main organ of our circulatory system. Its main job is to pump the blood throughout the blood vessels to all parts of the body. It controls the heart rate and maintains good blood pressure. This circulated blood supplies oxygen and nutrients to all parts of our body and carries away unwanted carbon dioxide and waste products for removal from the body. So we all know the role of the blood and how it is being monitored, mobilized by the heart. For easy remembrance, we can compare our heart to our houses. Our heart has walls, rooms, and chambers, and doors. Doors are valves. So there are walls, there are rooms and chambers. Plumbing vessels, that is the blood vessels, and electrical system is there. The pacemaker is there to enable the function throughout our life. So the heart is somewhat like our own houses, where it has rooms, it has doors, and it has plumbing, and then it has electrical system, all working in coordination to ensure that the heart works properly like a pump, and pumps the blood to the body and brings back the blood to the heart again for repumping to the lungs for purification. So that's how it works. So we can see the part of the heart. Heart has four chambers: the right atrium and left atrium on the top, and right ventricle and left ventricle on the bottom. The pointed part will be having a thicker wall, because it needs a lot of pressure to push the blood out of the body, which is very complicated. And the atrium, the top portion, the broader portion, will be receiving blood from the outside. So we will see how it works. So 10 key risk factors for heart diseases. It will be we'll see genetics is one of the reasons for heart disease. Obesity will be obesity and overweight can cause heart disease. Then high cholesterol in the system. So if you eat too much sweet and other type of trans fats and all those things, cholesterol will be produced more and it will be circulating, so that can become a blood vessel block. Then if you are indiscriminate in eating whatever you are supposed to eat, with high carbohydrates and sugars and more of trans fats, then that is a bad thing. lack of exercise. If you don't exercise, you just are a sedentary person, that can create heart diseases. Then diabetes is one of the causes. When you have high blood sugar, definitely there will be a cardiac issues. When the blood pressure is high, you'll have a problem. And if you are a smoker, you have a problem. And this age-related issue also, when you are too old also, there is a reason for cardiac diseases. And perieclampsia, it is like it's a disease which we will discuss now. So this is the basic reasons for heart disease. And the heart diseases are congenital heart disease, high blood pressure, cardiac arrest, arrhythmia, coronary artery disease, stroke, peripheral artery disease, congenital heart failure. So these are the things which are called the heart diseases. So types of heart diseases. Heart disease describes a range of conditions that affect the heart. They are blood vessel diseases such as coronary artery disease, heart rhythm problem is called arrhythmias, and heart defects are born. Heart defects we are born with, like we have congenital heart diseases and defects. The heart valve disease, disease of the heart, heart muscles, heart affections, stroke, and aortic disease. So the types of heart diseases, again, coronary artery disease, heart valve disease, normal valve, and the disease valve, the picture shows that it is too small. I have some problem on my system so that I can't show you full screen. The aneurysm is there, cardiac arrhythmia is there, then cardiomyopathy, pericarditis, heart failure. So cardiac disease and signs and causes. What are the early warning signs and general heart disease? So specific symptoms like ankle swelling, chest discomfort. All just concentrate on what I am telling. The specific symptoms like ankle swelling, chest discomfort, shortness of breath can be early warning signs of heart disease. So when there is short breaths, there is swelling in the ankles and discomfort in the chest, then there is a chance of getting there is a symptom or a signal for heart disease. What are the causes of cardiovascular disease? The primary cause of stroke and heart disease are physical inactivity, unhealthy diet, tobacco usage, and alcohol drinking. So these are the basic causes of that. For heart disease is inactivity, physical inactivity, unhealthy diets, tobacco usage, alcohol drinking. Regular exercise and maintaining healthy eating habits can help to improve our heart health. Intake of high saturated fatty food can lead to develop blocked arteries. So these are the main issues for that. You have to do a lot of exercise regularly, and to keep our heart healthy, eat right, and avoid saturated fats. So what are the symptoms of cardiovascular heart disease? The leading symptoms are chest pain, weakness and numbness of the legs or arms, breathlessness, very fast or slow heartbeat or palpitation. Then feeling dizzy, lightheadedness or fainting. Fatigue will be there, and swollen limbs will be there. So this is the picture of the diseased and the healthy heart. Normal heart, you can see there is no much fat distribution. It is it's almost pink all over. Whereas in artery disease, the heart, this is the whole artery has fat deposit on that, and these are the visceral fat which I discussed the other day. So these are the cause of blocking the blood vessels and having the artery cardiovascular disease. So normally what they do is, when there is a block, the doctors insert a stent and keep the block open. But the stent also eventually, after some time, if we are not correcting our type of behavior and food systems, food method, eating habits, the stent will also get blocked, because stent is also a hindrance to some extent, and it will accumulate all the fat or cholesterol what is floating in the blood. So diabetes is a degenerative health condition where our body either doesn't make enough insulin or can't use it as well. So we have discussed that insulin resistance is the cause of diabetes. So this can be either insulin is short, not produced at all, or if insulin is available, but because of the visceral fat and the poisons generated by the visceral fat, then even the insulin available cannot be used to convert the sugar into glycogen. It's a chronic, long-lasting health condition that affects our body's ability to turn the food into energy. Normally, our body breaks down most of the food we eat into glucose. They break it down to glucose and releases it to the bloodstream. When the blood sugar goes up, the signals from our pancreas is to release more insulin. Insulin facilitates sugars in the blood to enter our cells and to make it available for making energy. So this is how the system works normally. But with diabetes, our body may not be producing enough insulin, or the cells stop responding to insulin. That is, we know that it's called insulin resistance, and the cause we have already discussed the other day, resulting in too much blood sugars accumulated in the bloodstream. So blood cannot be absorbed, or blood cannot get rid of the glucose what is floating there, and the blood sugar will be high because insulin cannot process or enable or make the blood pass into the cells. So it will float around in the blood. Over a passage of time, this high sugar can be serious health problem such as heart failure, heart disease, vision loss, kidney disease. Diabetes and risk for cardiovascular disease. As mentioned earlier, accumulating high blood sugar levels due to diabetes can damage the blood vessels in a heart, inducing them to develop fatty deposit in them. The longer we have diabetes, the higher the chances we will have to develop the heart disease. Statistics shows that around 30% of the people with type 2 diabetes also have cardiovascular disease. For type 2 diabetes, there is an insulin resistance and they will have cardiovascular disease. What kind of heart disease does diabetes cause? Coronary heart disease. That is one. The coronary heart, the most common type of heart disease in people with diabetes are the coronary artery issues. The arteries that carry blood to the cardiac muscles have a buildup of fatty, waxy substance called plaque. So this fatty substance called plaque will be inside the blood. After a period of time, the plaque gets harder and makes our arteries stiff. So this plaque keeps on depositing on the flexible arteries. When you touch your arteries, feel your arteries, it can have the pulsation because the walls are thin and it expands and contracts depending on the heartbeat, and that is what we call pulse. So, but when this plaque comes and deposits under that, the flexibility reduces and the arteries will have a low pulse rate. How do you address diabetes and cardiovascular disease? Recommended corrective actions are controlling our body weight. If tested as diabetic, one of the most important thing we can do is to maintain our healthy body weight. So we have to reduce our body weight immediately when you are known to be diabetic. Sometimes in diabetes also, when you are affected, people lose weight, but some people may not. Most of the people won't lose weight. So we have to reduce our weight and keep it to our normals. We have to do regular exercise and physical activity. Various types of aerobic exercise should be done daily. We should stop smoking, then maintain optimal control over glucose, reduce or eliminate the intake of carbohydrates and direct sugars. So if you do that, then the body will not produce sugar at all. So if you eliminate carbohydrates and direct sugars, definitely your glucose levels will come down and your insulin resistance can be reversed. So that is also something which we have discussed on the other day in one of the sessions. Lower our LDL cholesterol, that is a bad type of cholesterol, by eating right type of food and doing workouts. The right type of food is again avoiding carbohydrates and sugars, and saturated fat also can be avoided. we can use omega-3 fatty acids to make things much better. So LDL cholesterol is an issue. So myocardial infarction. How does diabetes lead to myocardial infarction or heart attack? This heart attack's other name is called myocardial infarction. We have seen high sugar levels in the blood in diabetic patients can lead to increased arteriosclerotic plaque. We have seen the arteriosclerotic plaque is the plaque what is depositing on the arteries, and the disease is called arteriosclerosis. So that plaque is depositing on the arteries, and that leads to thrombosis. When it is not flexible, it breaks. The flexibility is required to accommodate the pumping blood inside that, and if it is not flexible, then there are tendencies to the arteries to break. It's called thrombosis. We'll have internal bleeding. This contribute to myocardial infarction. Autonomic neuropathy may predispose to myocardial infarction due to nerves not functioning as expected. Nerves also is required to pass on the right signals, and if it is not functioning properly, the signals may not go properly, and it can also lead into myocardial infarction. The nervous conditions will prevent feeling of pain and delay the diagnosis, which is possible in diabetic non-diabetic people will have feelings and pains will be there, but the diabetic people will have numb nerves. So the pain what is being seen by the normal people will not be felt by the diabetic people. So they may not have a pain in the chest when there is a heart attack going on. So that is another sad thing about the diabetic people. Can insulin cause heart failure? New study led by Abel and Kevin Yang at University of California, Davis, shows that too much of insulin in the blood, hyperinsulinemia. So when there is when there is too much sugar in the blood floating, then the body is pushed to secrete more insulin every time, and that insulin becomes useless. So that is, insulin resistance will be there, but body will keep on producing excess insulin, and this is called hyperinsulinemia, which contributes to heart failure by triggering a molecular chain reaction that damages the heart cells. So when there is too much insulin in our body, we will have heart diseases. And you can remember, when there is too much insulin, too much sugar in the blood, what our doctors used to do is to give us insulin injections. And when insulin is given in the body, they feel that it will reduce the sugar, but actually it will not reduce the sugar, because body is already having insulin and it is resisting the functioning of insulin, and then we give another dose of insulin. So we are asking for trouble and asking for heart disease. So heart failure, the normal heart and the heart failure, you can see heart is enlarged, and there will be swollen legs, and feet will be swollen, and he will have lungs will have fluid retention, and he will have chest pain and all those things. So heart failure will be like this. This is the pictorial diagram. So heart failure. So heart rhythm disease, the heart rhythm and diabetes. So does diabetes affect heart rhythm? Heart rhythm, there is a rhythm on which the heart has to work. The low or high sugar levels can lead to disturbance in the heart rhythm, and even to the life-threatening heart attacks. It can go to heart attacks also. New researchers found that dangerously high sugar levels overnight often can go undetected, because night when you sleep you have sudden high or low sugars, it can go undetected, and the patient will not be able to speak or talk to anybody, because he may be going into diabetic or insulin hypoglycemia, like that, or that condition. Rhythms may not work, heart may function wrongly. Prolonged periods of heart rhythm disturbances in older patients with type 2 diabetes can trigger associated heart problems. So he may not know what's happening, but the heart is going into trouble, and if it is prolonged situations, then it can go to heart problems. So do diabetic patients feel heart attack? So I've already mentioned that with diabetic people may not feel the heart attack. High blood sugar, high blood pressure, and cholesterol problems may raise the risk of nerve damage. So when the nerves are damaged, diabetes can affect our nerve impulse transmission and make the heart attacks painless or silent. A silent heart attack means that we may not have the warning signs, or they may be very mild. This can be detected only by performing a specific cardiac test and check if the patient is seen inactive or find difficult in moving around. This can be very dangerous because if he has a heart attack and we ask him to keep on moving around and all, he may go collapse and fall down, and it will become a non-return type of condition. So symptoms of heart disease is like a pre-diabetic or type 1 or type 2 diabetes. Symptoms of heart disease usually include chest pain, also known as angina, including feelings of the chest tightening or pressure. In some chronic cases, angina may not be felt. Shortness of breath, fainting or near to fainting will be felt, fluttering in the chest. Heart beats faster, not due to temporary increase in physical activity. So simply without doing any activity, the heart will be beating. So these are the conditions which is to be taken care of very seriously. The slow heartbeat will be there, dizziness or lightheadedness will be there, pain on both arms or one arm, numbness or feeling of weakness on the legs, neck or jaw or throat or back or upper abdomen pain, extreme fatigue, then nausea and vomiting feeling will be there. So these are the conditions of the heart. This is the pictorial diagram is there will be dizziness, the face can go pale, sweating will be there, body sweating will be there, chest pain, shoulder and arm pain will be there, difficulty in breathing, then erythemias will be there, and nausea will be there. So these are the basic symptoms of heart disease. So stages of heart failure. Heart failure is a chronic condition that worsens with the time. There are 4 stages of heart failures, that is A, B, C and D. The stages range from high risk of developing heart failure to an advanced heart failure. Stage A, this is considered to be the pre-heart failure. It means we are at a high risk of developing a heart attack, heart failure. Failure because of our family history of heart failure along with hypertension. So if there is a family history of heart failure and along with hypertension, then there is a stage A. You are very much potential to develop a heart attack. So stage A will have, there will be diabetes, coronary artery disease will be there, metabolic syndrome, history of alcohol abuse, history of rheumatic fever, family history of cardiomyopathy, history of taking drugs that can damage our heart muscles, such as cancer drugs. So these sort of medication also can cause the heart failure. Stage B. Stage B is also considered as a pre-heart failure. It means we are diagnosed of systolic left ventricular dysfunction, but we never had any symptoms of heart failure. Most people with stage B heart failure have an echocardiogram that shows an ejection fraction, that is EF, of less than 40% or less. Then the category includes people who have heart failure and reduced the EF, that is HF, REF. These are the arms of these electrocardiograms due to any cause. So if they have these sort of reduced or distorted the electrocardiogram arms, the wave arms, then there is a chance of to be very careful, and it is a stage B. People or the stage C people, the heart failure they have the heart failure already diagnosed and currently have or previously had signs and symptoms of these conditions. So stage C is already a heart attack patient. There are many possibilities, possible symptoms of heart failure of stage C, and the most common are shortness of breath, feeling tired, fatigue will be there, less able to exercise, can't do any exercise because of the tiredness and cannot do any exercise. Then weak legs, waking up to urinate, keep on waking up to urinate in the night. That can be for various reasons also. This is one of the condition. Swollen feet, ankles, lower legs and abdomen will have edema, will have like legs will have edema. We have seen the picture also. Stage D and with a reduced ejection fraction, people who have stage D and that is DHF-REF, these arm lengths are small in the electrocardiogram, have advanced symptoms that do not get better with treatment. This is the final stage of heart failure. So they will have definitely the final heart failure. So now this another types of heart disease is coronary artery disease. Most common cause of the heart attack is coronary artery disease, and that occurs due to the buildup of plaque. We have already discussed plaque, and it in the coronary arteries, main arteries that carry the blood to the heart. So coronary arteries are the arteries that carries blood to the heart. Congestive heart failure, long-term conditions that worsen over time. Its result in the weaker and even enlarged heart over time, causing the patient to feel tired and weak most of the time. Then heart valve disease. This occurs when the valves of the heart do not function as they should. This can be due to enlarged valves, extra valves and tissues that block the blood flow, or improper opening and closing of the valves. So if the valves are not functioning, then heart valve disease is indicated, leading to backward flow of the blood into the vessels. The signs of heart failure and congestive heart disease, a picture diagram is there. Chest pain will be there, shortness of breath, he'll have dizziness, legs will be swollen, and then sudden weight gain will be there, and then sudden fatigue and weakness will be there. These are the key symptoms. So valvular disease, which we can see, a normal valve will open and close like that. Normal pulmonary valve with this is aortic valve. Normal valve will be like this. Normal tricuspid valve will open like that, and normal mitral valve will open like this. But with stenosis, the aortic valve will open only partly and will not close properly also. And pulmonary also will be closed, not closing properly and open only partly. The tricuspid valve will not close properly and open only partly. The mitral valve will close like this and will still be open, and because of stenosis, and it will not close open properly also. These are the heart valvular diseases. So cardiomyopathy is the cause muscle tissues to become weak that can ultimately lead to heart valve disease and heart failure. Pericarditis. Pericardium is a tissue that surrounds and supporting the heart and becomes swollen and inflamed. The pericardium becomes swollen and inflamed. This can be acute or chronic, and when untreated can result in heart failure. So cardiomyopathy is that. Then arrhythmia, the heart beats in certain rhythm, and if it varies from the steady rhythm over a long period of time, so like if the normal heartbeat the pattern changes for over a long period of time, it can cause serious conditions called arrhythmia. People can be born with arrhythmias and can potentially lead to cardiac arrest. So when the rhythm is not right, it can go into cardiac arrest. Certain people are born with the problems, and they also can get into cardiac arrest unless which is attended. So cardiomyopathy is like this picture. The diagram is showing like that. Normal heart will have these sort of the wall sizes. The left ventricle is shown here, left auricle is shown here, and aorta. So here the hyper cardiomyopathy is there. The wall, the ventricular space is reduced so much, and the wall is thicker. Here you can see it is a restrictive cardiomyopathy where the total area is reduced, and then here is a dilated cardiomyopathy where the heart is overall dilated. So these are the cardiomyopathy, different types of cardiomyopathy. So 4 main kinds of cardiomyopathy. Hypertonic cardiomyopathy, thickened walls between the lower chambers of the heart. It is from the relaxing and filling up blood normally. So that is the hypertrophic cardiomyopathy. Then dilated cardiomyopathy is usually begins when the muscle in the lower left ventricle stretches and thins. Normally the ventricular muscles are thicker, walls are thicker, it thins out, and which makes the inside becomes larger and should be than it should be. So when the walls thins up and enlarges, then the capacity will become increased, but it cannot pump the blood as it used to do normally. Erythromyogenic right ventricular dysplasia. The scar tissues replace the muscular tissues in the lower right ventricle and of the heart. So that is then the restrictive cardiomyopathy. The lower chambers, ventricles stiffen and usually becomes a scar tissue that has been replaced by muscular tissues of the heart. This is the ventricular arrhythmia. Normal rhythms are like that. You can see there is a perfect, waves which is drawn on the electrocardiograms. But in ventricular arrhythmia or fibrillation, the waves are of not a specific pattern. There is no peaks and troughs are not there. So this is like a little technical, which we may not be able to grasp immediately. We need to study the heart, this electrocardiogram in a little more technical manner. So in summary, we have reviewed the various cardiac issues and the role of diabetes in triggering many cardiovascular disease and the dangers one can have due to sedentary lifestyle. So the main thing is, if you are active and you keep doing exercise and keep your normal walks, like 45 minutes of walk with speed and slow walkings, and maintaining well systematic aerobic exercises on your schedule, a very much balanced healthy diet and food habits can prevent coronary artery disease and help us to lead a normal healthy life. Thank you.
Anup sir,
Yes, sir.
one doubt.
Go, sir.
You said cardiovascular problems, heart
Yeah.
diseases, and diabetic.
Yeah.
Supposing
Yeah.
there is only fat congestion in the body,
Fat.
in the circular, in the
Fat, is it?
blood
Fat.
circular,
Fat.
then there could be possibility of blockage in the heart and heart problems.
Yeah.
But diabetic causes
Hmm.
internal disturbances, not only in the blood region, but also in all the organs, leading to cardiovascular
Yeah.
diseases.
No,
Am I
yeah.
correct?
No, sir. Just fat alone will not be a problem. You can be any size by fat. Like the sumo wrestlers and all, you can see they are very, very fat, but their heart is strong. So the fat, there are two types of fat which we have discussed that day. That is visceral fat and the subcutaneous fat. So when you see a fat person, he need not have cardiac issues. But if you see a person who is having high visceral fat, then he will have problems, because he will definitely have insulin resistance, and he'll become diabetic, and then his heart will become bad. So fat as such is not a problem. Visceral fat is a problem, and visceral fat is caused by eating carbohydrates and sugars.
Okay.
So if you
Thank you.
Yes, sir. So thank you,
And,
sir. I have taken up more.
One more thing I want to
Please, sir.
inform Irumban George.
Yeah.
That is, along with gelcimim, he can take pyrogenum or baptisia to the symptoms. 1 or 2 doses, not more, not daily, once in a day for 2 or 3 days. Not all the 2 medicine, either pyrogenum or baptisia. Let him see the symptoms
Yeah.
of these 2 medicines.
Yeah. So pyrogenium.
Along with gelcimim, let him give it.
Yeah. So baptisia is.
Supposing it is a summer condition, belladonna and these medicine, septic condition,
Yeah.
fever, septicemia, etc.
Yeah.
Like that you must. Only in winter and cold seasons, gelcimim should be added. Okay.
So baptisia is the best alternative, sir, because pyrogenium is normally given for septic type of conditions. some infection is there, some wound is there, some septic condition is there, then pyrogenium works well. And the other advice to Mr. George is to know the symptoms of each medicine. If then we can immediately compare the patient with the medicine. And the basic medicine, the arsenic album, has to be given to arrest the progression of the disease. Then the next is like if there is sneezing, then we have to choose is it simply sneezing or is sneezing with discharges. Then like if it is just watery discharge, then the immediate medicine is Elium-Cepa. And if it is for no cause, if it is discharge, it is not stopping by that, then a recommended medicine is acid nitricum. Because why we recommend acid nitricum? It's not at all written anywhere, but we can give that because the nasal linings are getting inflamed and irritated, and this acid nitricum immediately brings down, and the sneezing come down. Then if there is a fever, as our Surendra sir said, we have three things: baptisia, Eupatoria perf, and arsal. So arsenic album is there. Baptisia will reduce the other general conditions of the fever, and then Eupatoria perf is again a fever remedy, and all the aches and pains will be reduced by that. Then if there is a stupor, the patient is tired and his body pains, all joints are broken down, he's want to lie down, then Gelsemium comes there. So like that, you have to just select each medicine and then compare the patient with the medicine and then only give. That is how we do a case taking. No? So just giving medicine will never work because anybody can do that. You have to go symptomatic and case by case.
Mr. Anup sir.
Yes, sir.
Mr. Anup sir.
Yeah.
That Elium-Cepa doesn't work, sir, for sneezing. I've tried so many times.
That means there is some other cause, retaining cause is there.
Severe sneezing and nose block is there. Sometimes the allergy, that Elium-Cepa and arsenic album doesn't work sometimes. So you have to take allopathic medicine.
No, not at all necessary. You have not done the right analysis there.
Sir, Elium-Cepa I've tried, sir, and not working.
Your potencies may not be right. Potencies may not be right.
We used to try 30 potency only, doctor. 30 potency only.
No, that is what I'm telling. So Elium-Cepa cannot be blamed for not working. It is because of wrong selection on the wrong time. Elium-Cepa works, arsal works, everything works when it is not like, I'm not blindly telling it, it works too.
Okay.
Don't go for allopathic immediately for supporting.
So sometimes we have to do monitor calcium, we have to use it because of arsenic sneezing. That cetirizine we have to use it. Then only sneezing comes down.
So Sabadilla works, sir? Sabadilla.
Yeah, it works. There are medicines are there. It's not we should rush for that. Sneezing, Sabadilla works fantastic. Yeah.
If it is related to allergy, then we can give pothos.
Yeah.
Pothos is for the dust allergy.
Because recently I had such experience. One lady said she was cleaning the home, especially the blanket, and got the sneezing problem and throat. I immediately gave pothos, and within 2-3 doses it became out.
Yeah. No, Aconite works immediately for many people. Aconite is just like a handbrake for the car. But the solution we have to find out after that. So Aconite is a very good medicine for all these. The description of Aconite is a storm inside you can be arrested by Aconite.
Yes.
A storm comes, it can be stopped, but the cause will be have to be attended to. So Aconite can be given as a handy medicine because it works and goes in 15 minutes or half an hour. Aconite will not be in your body. So it's such a good medicine. It finishes the job and goes. Murthy sir?
You are better in the house, but when you go out, you get sneezing, other thing. Pothos best.
Yeah, dust allergy, pollen allergy, all those things can be done by pothos. Staph aureus is there for allergy. Then you have apis mel for allergy. There are many things depending on the patient. We can see it's not that one medicine is for allergy. It's not. We don't have such medicine. No, it's the patient's reaction we treat. Definitely, it will work. Murthy sir?
Yes, sir.
Yeah, you can carry on, sir.
Is my voice audible?
Yes, sir. Yes.
Namaste, my dear homeopaths.
Namaste.
Time is another 15 minutes only. Our George sir has asked regarding sneezing. What are the medicines available in homeopathy for sneezing? No, your mic is not work. Mic. Judge sir, mic.
Sir, Allium Sepa, Sabadilla, these two things
See,
I have tried.
Alliance HEPA, when a bland discharge is there, thin, bland, watery discharge is there from nose with lacrimation, then only Alliance HEPA perfectly it will work. Otherwise, then what is the medicine? Of course, Sabadilla is a sure shot, but that is not the only medicine. My question is, what are the medicines available in homeopathy for sneezing? For sneezing. Except Sabadilla, because Sabadilla we have discussed. That is sure.
We should know why we sneeze then. We should know why we sneeze. That is the important thing. You find out why we sneeze and then you can get the answer.
Unwanted element has gone. Something which is not acceptable by the nasal cavity. Then automatically sneezing will come.
It's a reaction to eliminate or throw out the unwanted element which is sticking onto the lining of the nasal lining. So sneezing is to throw the material what is irritating from the nose. So it has to be expelled. So that is the reaction which has to be addressed. The lining has to be addressed properly, and the reaction has to be brought to normal.
Tell me.
Aconite also works well for
First fundamental starting is aconite. 1 or 2 doses of aconite will automatically saturate.
Yeah.
By symptom wise, if you go, ammonium more will work.
Yeah.
Ammonium muriatica. Only sneezing and liquid is coming, and with some respiratory problems. Ammonium carb also will work for sneezing when the blockage is there. Nasal blockage will be there. So when ammonium carb differentiation to ammonium more, you will have some upper respiratory problem along with sneezing with discharge. Ammonium carb total blockage in nostrils. At that time sneezing comes. And another thing, this allergic, so many things will tell. Pothos, of course, best remedy. Apart from that, if you go Arundo, palate itching will be there.
Govind Barni sir, your mic is on and there is giving a noise.
Okay.
Palate itching will be there. Arundo is one of the best remedy for allergic, any type of allergic, sneezing or anything. Ambrosia is also there. This is also sneezing, any type of allergy it will work. For allergy, skin or nasal or respiratory, first and fundamental epismell. There must be some itching must be there, and frequency will be there, burning sensation will be there, stinging pain will be there. At that time only epismell will work. And natrum mur is also one of the best remedy for running nose or some nasal discharges with sneezing, and temperature will also be there, horrible headache will be there. And Staphylococcus aureus is also one of the remedy. And best continuously whatever the medicines we are taking, even also frequently sneezing comes means arsenicum iodum. That's also one of the remedy, which will help along with ferrum phos and calimore. Upper respiratory will be strengthened. But whenever we are taking iodiums, better to keep a secondary drug or a supporting drug as bio remedy, preferably ferrum phos and calimore.
Yeah, you can go for Bio 5.
Bio 5, otherwise Bio 5. Bio 5 means it will work from the throat to nose. Bio 6 means under the throat, respiratory.
Yeah.
So they will mention catra, cold, Bio 5, cough, Bio 6. So above throat up to nose, Bio 5. Bio 6, below throat, respiratory. But along with that, any medicine is available in allopathy, you have to give. But always bios you have to give twice a day. Single dose will not work. That too, preferably you purchase don't purchase loose, you purchase a sealed, any company. Any bios, whatever you are taking, you better purchase a sealed bottle.
25 grams pack.
25 gram packs will be there. Any company you can take it. You can go for Regweg or Allen, whatever it may be. And another one of the best remedy is Aurum Trif.
Yeah.
Aurum Trif. Very good remedy. Sometimes it will work excellently. You are coming from outside or from scooter, or you have removed your what we call the helmet and some what masks, everything. If you come inside, you are feeling somewhat uneasy nasally or throat wise or mouth wise. You go take one drop or 4 pills of Aurum Trif. Within half an hour, you will be set right. Aurum Trif also one of the best remedy. And Euphrasia, of course, if it eye problem is there, Euphrasia you can give.
Yeah.
Kali bike, if it is not working, Kali bike means fringy mucus and thick mucus will be there. Kali iode will be there. Kali iode also one of the best remedy. Any frequent sneezings are there, frequent nostril problems are there, any sinusitis continuously it is coming means Kali bike we have given several times, Pulsatilla we have given. At that time try Kali iode.
Iode.
Kali iode also one of the best remedy, or 3 to 4 doses if you give Kali iode. Again you can come to your mainstream of prescriptions.
So, whatever Murthy sir is telling now is he's listing a lot of medicines for the sneezing. But if you are treating a patient, we should know what are the other symptoms that the patient has.
Concurrent symptoms that we have to, along with main symptom, whatever the other symptoms are there.
Yeah. Only then we will know to select the medicine. Otherwise, we keep on giving other than
No, you have to select. Primary medicine you have to select.
Yeah.
Primary medicine selection is the properly, nothing is there means go for arsenic album. Secondary bacteria. These two wonderful. First it will arrest the progression of the disease.
Yeah.
Always arsenic album bacteria. For heaven's sake, don't go for influenza. Influenza means when along with fever, along with body pains, along with everything, deep weakness will be there. At that time only influenza you have to give. Otherwise,
no source can be tried.
Otherwise, influenza create weakness. Minimum 2 to 3 days. I think one person is accepting my point. Influenza 2 to 3 days weakness will be there.
Yeah.
Next, sticta. Nasal itching will be there. Because of the itching, sometimes sneezing and sometimes running nose or whatever it may be.
Yeah.
Sticta is also one of the best remedy. And another remedy, Teucrium aurum virum.
Polyps.
When worms are there, when polyps are there, both. Worms are there means Teucrium will work. Even polyps are there also, Teucrium will work. For polyps, what is the main remedy? Lemna minor.
Yeah.
Lemna minor is the main remedy for polyps. So along with that, you have to give Teucrium aurum virum. Teucrium aurum virum or MV Teucrium, something you write. Along with that, if possible, you can give Calcarea fast or Calcarea floor according to symptoms. Mic on karo. Sir, judge mic.
Sir, recently I got a case. A person was having almost continuous infection in the middle ear. Infection in the middle ear. So the ENT specialist told him, there is a lot of pus formed inside and you have to operate it and suck it out.
Okay.
Then some other another ENT doctor said, no, don't do it. We'll try with medicines.
Okay, very good.
So I also gave, because I told him you continue that and take Pulsatilla and Beritacarb. But there was no aggravation, but he did not report any
Heparsol
improvement.
Heparsol you can add, Calimur also you can add.
Heparsol also he can. Yeah,
Heparsol and Calimur can be good.
Very good. Pulsatilla. See, for that symptom, what you have told, Heparsol, Calimur, Pulsatilla. These 3 drugs, for within 10 days, some improvement you can see. After that, you can select some other medicines.
Okay.
See, what infection can happen in the middle ear? Bacterial infection is a secondary infection. The primary will be something else. Mic off. Mic is off.
He is having frequent cold.
Yeah.
So doctor said it is because of that only. Exposure to cold.
Eustachian canal will take the infected phlegm into the ear and then it can infect there. But
Yes.
but normally the outer ear and inner ear, the infection will be different.
Yes, this is they call it a middle ear.
Middle ear infection. The middle ear will
It
be
is,
middle ear will be connected to the outer world through the Eustachian canal.
yes.
From the throat to inside the ear, from the nose to the ear, inside ear, there is a connection. Eustachian canal, and that when it's blocked, only when we go in the flight and when that is blocked, we get a, the ear will be blown out and we'll have a ear block. Eustachian canal it's called, Eustachian tube. So infection can go from the nose through the respiratory area through the ears with that canal. So we have to address that Eustachian tube treatment, and for which Kalibai is one of the important medicines.
Okay. And I referred to this book of Professor Gobinath. He has mentioned about tellurium. Tellurium.
That is a good medicine.
On this?
That is a good medicine. Very good medicine. To tellurium. In the middle ear it will work. And even
Yes.
then also, Heparin sulf, calcareous sulf, these medicines we have to give primarily. Tellurium we have to go second. Because if you put tellurium, the other medicines will not work.
Oh,
In tellurium, you will have itching. Itching feeling will be there.
okay.
You will always keeping one finger in the ear.
Okay.
You
And the
address-
problem is mostly in the night.
Yeah, you address this Eustachian canal treatment. That will help him to get the infection.
What is the age, sir, for that patient?
54, 55, yes.
Have you tried the mullein oil?
No.
Verbascum?
No, sir, I have not.
You read Verbascum first, 30 potency.
Okay.
Tellurium, when you selected tellurium means, please read Verbascum also. So that also may work, because all new medicines, first you go through. 3 points you note down. It will be remembered in your mind. So our time is over. One more thing, Surendra sir has asked one question. With cardiac and diabetic,
Yes, sir.
for that generally what are the medicines? Because all are having this type of diseases or disorders, whatever it may be.
But Anup has not included in his presentation about the homeopathic treatment this time.
Next time we will review.
We'll do it next time.
Theoretical only told. So if you start on the what treatment also, we have to bring our pillows here. That will complete minimum 1 hour.
Yeah. So we will discuss that anyway.
First, I have asked, a person is having a diabetic along with cardiac. What are the medicines? A simple. Every time we are thinking about it, everybody is taking also. I think some of our people regularly they are taking. Diabetic Syzygium gymname. That is mother tinctures. Heart, Crataegus, Strophanthus. Crataegus and Strophanthus. Daily we have to take.
Yeah.
Twice a day. Once Crataegus, Strophanthus, one set. And another set is Syzygium gymname. Along with that, please read one drug. It is a new drug. Secal Cur. Please read.
Secale Cor.
Secal Cur.
SEC.
If symptoms tallies.
SECALECOR.
Scale.
SECALE coronatum COR. Madam Bhona, madam. Hello, Madam Bhona. Bhona Sundar.
She is not there, I think.
Unbelievable Peter
Hmm.
Sorry, because if possible, I want to ask her to take next class as a special class.
Okay.
Because the past 2 months I have never asked anybody, because I am somewhat busy. So I have not. So today, actually, half an hour back, I want to ask. I forgotten that one. Anyhow, today I have to catch off that lady. Or anybody is there to take next week? I think George sir can take. You are practical.
No, sir, not,
See.
not for the coming 2 weeks.
Your cases.
I have-
You can discuss these cases. You have told nearly today nearly 6 medicines. Like that you can discuss, because you are treating now or 4 cases. If you take minimum 45 minutes, it will go. Why don't you take? We will also share your knowledge to us. Why
Oh,
don't-
next year I have a conference, sir. I have to present something, so I am bit
Okay,
busy.
okay.
I will do that after that.
Next
I will
month,
do
next
that.
month, by January. In New
Ah,
Year.
yes, sir.
Next year. Next year,
Yes.
first month.
Next year, sir. Next year.
Next
I
year,
will.
first month.
First month,
Yeah,
January.
okay,
I can
okay,
do.
January. Okay. Mona madam. Uh, Sujata madam is there?
Yes, sir.
Yes, madam. Anything
No.
from your side? Practicals?
Practical cases I'm having, so I'm handling,
Ah.
but I will discuss and I will tell you,
Okay,
sir.
okay. Anyhow, next week one guest lecture is there. We have to select only. After after contacting Bona madam and Sujata madam, we will decide next week will be this one guest lecture will be there.
Okay, sir.
So Secal carinatum, please read. And tellurium you read. These 2 medicines, new medicines we have told that one. You please read and note down 5 to 6 points. Because Secal carinatum will work for diabetic and heart also.
Yeah.
Okay, time is over, sir.
Okay, sir.
Thank you very much. We'll
Thank
meet.
you. Thank you very much, sir.
We will
Thank you very
meet
much.
next week.
Thank you, sir. Thank
next
you.
week
Thanks a
with
lot.
guest lecture. Thank you. Thank you.
Thank you, sir. Thank you, sir.
Thank you, sir. Thank you.